Welcome to Webinar Wednesday. We're excited about today's presentation featuring experts Tony Bailey, Director of Product Marketing, OT Security of Nuvolo, and Carter Groome, Chief Executive Officer of First Health Advisory. Carter and Tony will discuss the top 5 things that First Health Advisory and Nuvolo have learned so that you can implement an effective OT security program. Webinar Wednesday would like to thank our sponsor, Nuvolo. Nuvolo Connected Workplace for Healthcare is where support teams like HTM, IT, real estate, maintenance, supply chain, pharmacy, clinical care, and more work together on one platform to support the doctors, nurses, and all care team staff. To learn more, please visit nuvolo.com. A few announcements before we get started. MD Expo strives to provide healthcare technology management professionals with a unique, intimate, and rewarding conference second to none. Please join us in Las Vegas on November 1st and 2nd for the 2021 MD Expo. Please visit mdexposhow.com for details, registration, and our steps to a safe and clean meeting environment. While you're there, make sure to sign up for our newsletter so you always receive the most up-to-date information. Let's give one lucky attendee the opportunity to win a newly designed Webinar Wednesday shirt by answering the following question. Nuvolo will be exhibiting at which booth numbers at the upcoming MD Expo in Las Vegas? You can find the answer by visiting our sponsor's website. Please use the questions feature on the GoToWebinar dashboard to submit your answer. As always, today's webinar is eligible for 1 continuing education credit from the ACI. You can obtain your continuing education certificate by completing the post-webinar survey. More details on this at the end of today's webinar. We will wrap up with a live Q&A following today's presentation. You can submit your questions at any time during the webinar by using the questions feature on the dashboard. We'll get through as many attendee questions as time allows. As I mentioned earlier, our speakers today are Carter Groome and Tony Bailey. Tony, you may begin whenever you are ready.
Great, thank you very much, Jennifer. And as Jennifer mentioned, today we're going to be talking about the 5 lessons that First Health Advisory and Nuvolo have learned around implementing an OT security program. My name's Tony Bailey, Director of Product Marketing with Nuvolo, and joining me today is Carter. Carter, I'll let you give some background around First Health Advisory, working from this slide.
Yeah, thank you, Tony, and thank you, Jennifer. And I also want to just say I'm appreciative of Tech Nation for providing us this platform, and really grateful to all of those that have joined today and taken time out of their day to listen to Tony and I speak about this really important topic. Just briefly on this slide, First Health Advisory, we are an OT asset risk and orchestration advisors. And so we work with technologies, we build process, we develop governance to turn a vision of reduced risk and greater efficiency into reality. It's what we do every day. It's our passion, it's our craft. And we engage exclusively with HDOs on services that range from targeted assessments to multi-year managed programs, or even simply if you need an HDM cyber expert. You can see the core services here and come to the conclusion that no single individual can bring all of this expertise to the table. And our team is comprised of clinical engineers and HTM professionals, network, infrastructure, policy framework, vulnerability management, program leaders, and even clinical and departmental specialists. And this multidisciplinary approach to OT security, hygiene in your organization is sort of woven into the lessons that we've learned as organizations like yours address how to take on this initiative. And so I'm grateful to share with this group today. Thank you.
Great, thanks, Carter. So if you look at the agenda today, introductions, so checkbox on that one. we'll talk a little bit about OT security and operational technology, just by definition of what that is, and then why it's important to address OT security. And then we'll really dig into some of the lessons that we've learned. And then we'll start to conclude where we'll talk about some next steps for you and your organization around implementing an OT security program. So by our definition, for those people that aren't super familiar around OT, so we talk about operational technology as any non-IT asset that's connected or not connected to the network. So basically with the ability to connect to a network, and we'll dig into that notion a little bit later. So you can think of things like medical devices in the healthcare field, along with things like facility systems in a healthcare setting. It may be things like HVAC controls, and those kinds of things. So that's sort of by definition how we talk about operational technology and contrast it with IT. So today, why would you address OT security? So at a fairly high level, one of the important things for organizations is really to ensure the reliability of their services and really hone in on making customer satisfaction job one. And things like improved patient outcomes are always sort of top of mind, certainly for healthcare organizations. And whenever bad things happen, or things happen that weren't expected, you really need to be able to protect the brand and minimize things like not just patient outcomes, but financial risk as well. And sort of underpinning all of that is the availability of critical medical devices and facility systems, and the performance and safety of those assets and equipment. And Carter, if you'd like to add more to this slide as well.
Yeah, that's a spot on, Tony. And just a comment on your previous slide on what is OT. When we think of programs that we're building, having that definition within your organization is absolutely essential. It's key to defining, responsibilities, accountability, and ultimately workflow among the stakeholders. And so that's one of the things we do early on as we help organizations build these programs. But the question of why you address OT security, right now, even for organizations with advanced security capabilities and maturity, OT asset security is a blind spot. And the question is, does your organization, does your board, does your leadership want to accept that risk? We work with hundreds of hospitals, and tolerance for risk is all over the map for many different reasons. But there are some risk trade-offs every day, but saying you're not going to do anything about this particular challenge is a risk that I would not accept. It's a big one. And I'd suspect that you wouldn't be on this call today if you didn't share that sentiment.
Great. Thank you, Carter. So as we started to dig in around the notion of OT security, one of the biggest challenges that we've come across is this concept of having a fully comprehensive inventory of all the assets. And one of the challenges in many organizations is that inventory data is incomplete for various reasons. It may be things like tracking assets using spreadsheets in different departments or different databases, using non-standard naming conventions between inventories. So you imagine, let's say a data field in one inventory talks about make and model, in the next inventory it may just talk about model. And so that's not having a consistent naming convention make things problematical. And some organizations we've come across actually have multiple maintenance platforms. So they may have one area where one team is focused on, let's say, medical devices, infusion pumps, and another team has a maintenance platform for the facility systems, the HVAC controls. So that ambiguity and that unknown around OT information can make things problematical. And Carter, would you like to add to that slide?
And look, my comment is what you see on the screen here, and with Tony's comments, behind this is a lot of work. And we'll touch on that piece as we step through some of these lessons learned. But I think one of my key takeaways as you listen to us is to understand that, that there's no magic bullet, or just wave of the wand and these things happen. There's a lot of effort and commitment and patience and time that goes with what we're going to talk about here today.
Yep, for sure. So let's sort of give an overview of the things we're going to talk about around the actual lessons learned. So the first thing that we'll cover is how, let's call it traditional IT security controls and tools just won't work for OT devices. We'll dig into that notion, and how a single inventory and a single source of truth is absolutely critical for a strong OT security program. And then we'll dig into the concept of how there are some really just excellent OT security monitoring tools out there and discovering tools that do a really awesome job around monitoring and discovery, but they're just not quite enough for a strong OT security program. And then Cod will go fairly deep around how the notion of maybe trying to do a DIY approach is either too complex, or there's just so much overhead required around trying to take a DIY approach. And then last, and probably most importantly, is how important a system of action is required to be able to respond to events. And Cod, if you want to add a little bit more color to those 5 areas.
Yeah, I think this is what we think about every day, and as we dive into each one of them, I've got a lot to share. I think my own challenge will be not to go on for 5 or 10 minutes on each of these.
Great. All right. Thank you. So let's start with number 1. So if you think about traditional IT security tools, they're really good on monitoring things like laptops, servers, switches, and routers. And however, in the world of OT devices, if you imagine a security event occurs, and the IT security team may be there with their tools, and they're sort of seeing this unusual behavior, either traffic taking place over the network, or they see this IP and MAC address, and the IT team sort of looks at this and goes, now what is this IP and MAC address? We think we know what it is, but we're not totally sure. And in fact, who even maintains this device? We think it's an infusion pump. We're not totally sure, and we certainly don't know if that pump is delivering chemo or saline. And so what may happen in this scenario is that the IT team picks up the phone, calls up the HTM group or the HTM team, who, by the way, may be completely unaware that there's even an issue with this medical device. And so the IT team picks up the phone and says, hey, we're thinking about going into firewall settings and blocking the port that this device communicates over. Any reason that's a problem for you? The HCM group may say, either I have no idea what you're talking about, firewall, ports, communications, or completely unaware that even an issue, or as may happen in a healthcare setting, in a highly regulated area, that device may only be allowed to be touched by an authorized person. So the HCM group may respond and say, please don't touch that infusion pump. You're not authorized to do that. And it may be even in the middle of delivering chemo to a patient. So there's a life-setting impact there. And I'll stop there to give Cod a chance to provide some input also.
Yeah, these IT security tools, they're absolutely an important source of data to leverage, correlating security information with other non-invasive telemetry technology or tools to better understand how you prioritize risk, but also determine how you optimize or how you become more efficient in applying certain risk treatments or controls. And so, what Tony was talking about is, the nature of OT service requirements are so different when considering an adverse patient outcome that in many cases you simply just don't want to do automation that IT securities are so good at. And you may need additional information and context before you apply that control or even consider automating some type of response. And so that's why they're important, but that doesn't, end the story in reducing risk.
For sure. So there's one of the lessons that we've kind of come across over time. The second part is, as we mentioned right at the very beginning, a single source of truth is critical for your assets. And that's established really by having a single inventory where everything resides with a common data model. And then by having that in place, when it comes to remediation, which we'll talk about in a few moments, when it comes to remediation, everybody's kind of speaking the same language. Everybody knows the context. They can correlate security events across multiple devices, and that really helps for the remediation workflow. And I'll stop there to give Carter a chance to step in.
Yeah, I think to reiterate, IT and OT devices, they're treated differently. This is what makes the challenge of protecting connected clinical assets in a healthcare setting unique. And it's okay, in my view, to have a different source of truth or authority on these types of devices. And to my point earlier about clear definitions on what an OT asset is, that's so important when you start to divide the responsibility and accountability and who gets contacted and what are the workflows and processes ultimately that are going to allow the right individuals to apply those risk treatments, to apply those controls, or whatever decision is ultimately made. And so having that source within the context of how you, let's call it an HTM or clinical engineering work, is so important. And we could do an entirely another webinar on how telemetry and analytics can come together from both sides, IT and OT. Yet at the end of the day, having the ability to create a work order process for cyber vulnerabilities in the system that you use is absolutely essential. And so I'll conclude by saying that the correlation of data delivered to those accountable for these assets and presented in the context in which you operate is the cornerstone of how you mitigate risk, you maintain integrity, and minimize operational downtime. That is why we're here.
Great, thank you. And then the third sort of lesson that we've learned is, as we said, OT security monitoring and discovering tools have really evolved nicely over the years. They do a really excellent job. We thought we'd illustrate this notion here of they're not quite enough by showing a maturity model, if you will, around OT security. So we think of this maturity model as level one, where great, you've established a single source of truth and you have your inventory in place. However, just having the inventory doesn't really help you around OT security events. So now you may be looking at or you've purchased an OT security monitoring tool, but there's no integration between that tool and this single inventory, this single source of truth. So the challenge there is, if a security event takes place or something is plugged into the network and discovered, there's not really any context there around the device. What is the device's maintenance history? Who owns the device? which table in a room is that device located on? Those kinds of things. What is the warranty and the service contract status of that device? Another piece of context that's important. And then when we look at this maturity model, you may have kind of moved this on along a little bit, where your single inventory has some limited integration with the monitoring tool. So if a security event takes place, you can see what device is impacted by that event. But still, it's not quite getting you to the place that you want to be. And what we've learned is those organizations that aspire to what we refer to as level 4 is that they've got a single inventory, they've got a OT discovery, a security monitoring tool in place, fully integrated with that inventory, so that when an event takes place, you've got the rich context associated with that, but also you have a system of action in place. So you can then start to think about, okay, let's set up a work order to dispatch the authorized person, and here's the remediation steps, either based on manufacturer's input or on things like NIST databases that provide a national database around vulnerabilities. And I'll stop there so Carter can sort of provide some color around this slide as well.
Right. These OT security monitoring platforms or tools or appliances or whatever you'd like to call them, they're amazing technologies. They're powerful technologies if tuned appropriately and integrated. They are, in my view, a pillar to these programs that we talk about when we want to reduce risk and create efficiencies in the life cycle of managing assets and OT assets at that. But they're not inventory systems. When Tony and I talk about OT security context, it marries the information that comes from these powerful tools with the service history, treatment instructions, your PMs, your CM process, information that gets sent to the CEs and the OEMs. All of that comes together, and these attributes, these device attributes, are needed to understand and address risk. And all this information is orchestrated. Really, it's I think a good word for it. And patterns emerge where then the power of a well-designed program can really reduce risk. I mean, really reduce risk, and not just say, well, we know this is out there, we know this is out here. We don't know who's going to do it or what's going to do it, or there's friction between IT and HTM and all this stuff. When all of these things come together, that's the power, and that's what you can use to reduce risk.
Great, thank you. So for the next two slides, Carter's going to sort of lead those slides. So I'll start off with the slide number 4 around DIY approach. There we go.
Yeah, the do-it-yourself approach. And what is a do-it-yourself approach? You may be, have something in mind that you're doing, that your organization and another, health system is doing something else, and perhaps it's not too complex, but it's just too darn onerous in many ways. And the things that you see on this slide, in my view, it's almost impossible to ever catch up. It's like you're on a train and you're putting coal into the fire to keep the train moving, but you can stop putting coal into the fire. There are already so many existing gaps and vulnerabilities that you're probably aware of, or maybe you're not. Perhaps IT is aware of them, and you're feeling overwhelmed already before you've even got all this information from a passive scanning solution, or you've got clean information in your CMMS system, and but a programmatic approach to this, that involves technologies that we've talked about already, processes in terms of how you even work tickets and how that gets back to the IT department. All of that workflow and the people involved. It takes work, it takes commitment. But thinking you can do this stuff off of spreadsheets or using, just traditional IT security tools, or do it all by physical inventories, whatever the approach is that you're doing, I don't see any organizations ever feeling like they're getting caught up. They're getting to this steady state. And so leveraging all of kind of what we've talked about here, will eventually get you there. And then we start to think about joint commission. And yes, you have to have an inventory and a service history, but now you really must appropriately address the cyber posture of these assets. And that has to be done in your system of record.
Great.
And this kind of last lesson learned, requiring that system of action, that system of record. We've talked about a lot of the things already on this slide: automating, responses and work order process, and prioritizing what you need to correct or mitigate first, and how you step through remediation and track the status. All of these things, we've touched on. But having a roadmap and understanding how you want to reconcile your data, getting clean information into your Nuvolo or CMMS platform, ensuring then from there that when you start to get information from these powerful passive scanning solutions, that you have a high match rate. Do you have MAC address here, MAC address there? Do you serial number here, serial number there, IP, whatever that high probability of matches, that's what you're working towards ultimately, to give you that ability then to get after the risk. You truly know, okay, this is the device, or this is the fleet of devices that we need to get after. And so through that process and through the program, you start to find more efficient ways of doing so that fit into some of your existing processes, CMs, PMs, and workflow. Ultimately, that is going to move the needle on becoming more efficient and reducing risk.
Great, thank you. So let's think about then taking those lessons and what this kind of looks like. Let's call it the new world, having taken those lessons on. So now, if you think about it this way, for OT security and remediation, when a OT security event takes place, leveraging a discovery security monitoring tool, what Nuvolo does is we take this approach. So we've established, using Nuvolo, the single inventory, the single source of truth. So now when a security event or vulnerability is identified, Nuvolo actually brings that information into an intelligence hub, if you will. And so now, as Carter was saying, is you've got this matching of MAC address with the rich context around what these devices are doing, where they're located, what their warranty service contract is, their maintenance history, and the name of the device owner, which, by the way, name of the device owner, it may be an internal name, it may be a field tech from the manufacturer that comes in and does field servicing. And so now, for the IT security team and the HTM group, everybody's sort of speaking the same language, which is there's an event or a vulnerability. Let's say hypothetically, it's infusion pump in room 7B in building 4. And Tony Bailey is the owner of that device. So let's set up a work order because we've identified from the manufacturer the remediation steps. Here they are. Oh, by the way, install latest firmware or these configuration settings. Or, as we said earlier, the IT security group may say, yeah, we want to actually apply this security policy to this device. Okay, we've identified what the device is. You're okay to do that. Permission granted, if you will. And so here's the remediation steps. So, Carter, if you'd like to add something.
Yeah, as you consume this picture, the thought that I have is, this becomes an enterprise risk initiative, really. And so you're not just thinking in the context of cyber risk, you're thinking in the context of operational uptime risk, patient safety risk, and balance sheet risk, frankly. And when I talked about it being a multidisciplinary activity and overall program, this starts to get to that point where there's collaboration amongst the stakeholders to ultimately reduce risk. And a lot of what we do when we come into an organization, yes, there is technical integration. We're integrating the tools, but there's also what I like to call, organizational integration. And, that perhaps might be even more important than the technical elements of this, and having CE and HTM work with clinicians and departmental heads and the OEMs and the security and IT team and the GRC team. That operational integration is essential to meeting the outcomes and the desired risk reductions that the organization wants to get.
Yeah, for sure. And then the next view here is just sort of illustrates some of those discovery and security monitoring tools whereby Nuvolo can bring in the information that they're gathering around discovery and security events. I wanted to add, we didn't quite touch upon it earlier, but we talked about OT and the ability to connect to the network. So you might notice here that with these tools on the left-hand side, whenever something's connected to the network, Nuvolo can bring that information in. There's an important point here is, what about your devices that are on the loading dock or they're in the storeroom somewhere? They've yet to be onboarded, so they're not connected to the network. However, if a vulnerability is identified, you still need to remediate those devices as well. And the great news is, since you've already established a single inventory of everything on the network, everything that's procured, and everything that's yet to be onboarded, you can address those as well. Let's see here. And then the next slide here is really talks about the notion of, it's great. Some healthcare organizations, have the luxury of really strong, well-funded, well-budgeted in-house teams that can implement a strong OT security program. And I'll let Carter speak to the rest of the slide.
Yeah, in the slide notes vulnerability management, but as you look at a program holistically and all the things that need to come together, that people that process these technologies that you see on the screen, and they're all very, solid technologies that are doing great things for healthcare, you need to be able to kind of look at all of that together and see not only how they're integrating, but are you getting the right information to the right people at the right time, from these tools? So we're looking programmatically at the IOMT platforms and tuning those platforms to make sure that the information is connecting with Nuvolo. And you absolutely have to have the OT security module then to get the fields and the context that we've talked about earlier into your system of record. And that's when you can really get after the vulnerabilities, and that's when it becomes a vulnerability management program for OT assets.
Yeah, for sure. So the next slide really starts to sort of conclude where, we've told a great story. We've shared some of the lessons that we've learned. So you may be sitting there going, okay, just how do I get started on my OT security program? Where do I go from here? And so we sort of lay this slide out, which is the three steps to a strong OT security program. First and foremost is let's establish that one single source of truth for all of your assets connected to the network or not. That can be medical devices, it can be facility systems. Think about things like HVAC, hospital bed, power supplies, those kinds of things. Establish that. And then with Nuvolo, you can work with these discovery and OT security monitoring tools to bring in their information around security events and vulnerabilities and security assessments into Nuvolo. That integration piece is really important. And the last part is that system of action that we talked about, which is it's all well and good that you have a single inventory and now you're seeing events match with full context. But what are you going to do about it, and how are you going to do that? And that's the system of action step through, which Nuvolo enables as well. Carter, anything that you'd like to add on this slide?
Yeah, it all builds up to that third element, the orchestration and remediation. And, this is the goal of organizations that are building a program, and understanding, I mentioned this is work, but understanding that this could take a year, 2 years, sometimes 3, depending on the size and scale of your organization, the physical, reach of the organization. All of those things, are accounting for, how much effort is associated with getting to this steady state of the ability to react and respond to, vulnerabilities that exist within your OT assets.
Yeah, great. Let's talk a little bit about the Nuvolo Connected Workplace, because this kind of brings the story together. So we talked about having that single inventory of all of your assets, leveraging OT security. And actually what we do is we leverage Nuvolo's maintenance solution to do that. That establishes the single inventory. But there's other components of the Nuvolo Connected Workplace that also, in that same platform, also stores information around your space and real estate. They may also be core components of your integrated workplace. So I just want to call that out, sort of the big picture view around Nuvolo. It's not just the maintenance piece, single inventory, along with OT security. It's also, where does that equipment reside? And then what buildings does it reside in? And for that matter, are those buildings smart buildings with strong sustainability programs? So I'm kind of bleeding out a little bit from the pure OT security program message on this slide, but I just want to kind of underpin, how we bring all these things together, and the fact that it's all on one platform. Your view is on one platform with a single database of all of these things. That enables that workflow that Carter's been talking about, along with the service portal. And then for many organizations, reporting and analytics is absolutely key. So the fact that you can, for example, report out of, here's all our medical devices, and oh, by the way, here's the ones that are past the checklist, if you will. They're remediated, there was an event, but yes, we've addressed that. Oh, and by the way, here's all the devices that have yet to be onboarded that had vulnerabilities, but we've addressed those as well. So that reporting and analytics piece is really key. And I'll stop there. So this is our last slide here, and it's an opportunity for you to learn more from this link. Feel free to email myself or Carter if you have additional questions. And then Jennifer, if we have any questions come in, we'd love to attempt to answer those.
Thank you so much, Tony and Carter, for all of this valuable information. As a reminder to our audience, if you have a question for our presenters, please use the questions feature on the webinar dashboard. We do have a few questions that have come in already, so we'll start with those. The first one is for you, Carter. When a device is connected to a network, how long does it take a monitoring tool to discover that that new device and bring in the information to Nuvolo?
Yeah, good question. It should be instantaneous. I mean, if all the things that we've talked about in terms of leveraging your IOMT passive scanning tool are operational, and the integration with Nuvolo is in place, and the matching is there, you're going to get that information instantaneously. That's the intent, and that's the power behind using these technologies to feed information to the people that need to actually go out there and touch these devices, have hands on these assets, and reduce risk.
Thank you so much. Our next question is for Tony. Our IT team uses their network detection tools to identify unusual network traffic. So why would we need the intelligence hub that you referred to earlier?
Yeah, so as Carter and I both discussed, IT security tools do a great job for traditional IT, such as laptop servers and switches. The challenge is when those tools pick up, let's say, unusual network behavior, they're not going to have the context around what's impacted. And again, to reiterate what we said earlier, context can be things like where is the device located? What's the owner's name of that device? What is the device doing, for that matter? That infusion pump example that we gave, or let's imagine it's an MRI machine. Is a patient inside that machine right now as this event's taking place? Having that information, based on operational and maintenance history is really key. And so those IT security tools, while they do a great job on network traffic monitoring, without getting too technical, but there's only so much information you can glean from what traffic is passing over a wire. And it's certainly not going to tell you maintenance history or the device owner's name.
All right, Carter, our next question is for you. We
Okay.
already have ServiceNow in our environment. So what overhead is required to then implement Nuvolo OT security?
Good question. And I'll just remind folks on the call that Nuvolo is a native application in the ServiceNow environment. So you don't have to do integration with ServiceNow to do integration with Nuvolo. It is a native application of that. And there is work, as I've talked about in this discussion. As you acquire a license for OT security, you'll want to better, understand what needs to be done in order to share the information between the scanning technologies and get that information cleanly into the Nuvolo platform and your system of record. And so that may require some tuning of the tools. It may require some reconciliation. It may require some matching related activities. You might include some physical inventory or build it through your regular preventative and corrective maintenance schedules. And so understanding what needs to be done, but also understanding that there is work to be done is important. We don't want to have any surprises where organizations think, well, we've got all the tools. Why isn't our risk being reduced? There are activities that need to go with that to really optimize what we've talked about when we're orchestrating and reducing risk around these assets.
All right, our next question is, why is a security monitoring tool not enough for us to respond and remediate security events?
Carter, do you want to take that one?
Yeah, I think if we're talking about the sort of passive scanning technologies that Tony brought up on one of the previous slide, we certainly have touched on that, but I'll reiterate some of the high points. These are very powerful tools, and they've really changed the game. From Excel spreadsheets to getting information real time, as we talked about, and a lot more accurate real time information about where your devices are and how they're behaving. Yet again, they're not inventory systems. They don't carry with it those service histories, the treatment instructions, who at the OEM you need to talk to if there's an issue, and make sure that you're not breaching some sort of SLA or contractual understanding. All of those device attributes, as I said earlier, they're needed to understand and address and even prioritize risk. And those patterns that I discussed earlier then begin to emerge where, a well-designed program is actually going to move the needle on addressing risk.
All right, our next question is, what is one trusted source?
Tony, do you want to take that? I could then add to it.
Yeah, I'll take that one. So when we talk about one trusted source, so basically, if you think about having a single inventory, I will elaborate a little bit more, a single cloud-based inventory that contains all the data fields that describe your assets, make a model, the maintenance history. Within those entries, it may be things like the warranty and the service contract, the name and address of the owner, the manufacturer's field tech, those kinds of things. So that's when we talk about a single source of truth. It's a single cloud-based inventory. And by the way, every time a maintenance team, a clinical engineering team works on a device, they will access this inventory because it's a maintenance record. They will access this inventory and update the record. So let's imagine they work on an MRI machine on a Wednesday, and they put in, let's say, the latest firmware on that MRI machine. And then on Thursday, a vulnerability is identified for that maker model. Well, the great thing is the record is updated to say, oh yeah, we're fine because the manufacturer recommended this firmware be installed, and we did that yesterday. And it's all in a single source of truth for everybody to see, by the way. Go ahead, Carter.
Yeah, I look at it as the authoritative source or single source, but it's really not efficient if you're in HTM to have to go and look at security tools to get the information you need, and vice versa. When you're talking about ticketing process and understanding that workflow, things have to flow through the system that the individuals that are accountable and responsible for actually going out there and doing the work with it. That's how I describe it, and it may be a little bit different from Tony's view, but you can't have 6 different things that you go to bring all the information together to make it a decision. That's just purely inefficient.
Yeah.
All right, our next question is, how does Nuvolo monitoring tool integrate and monitor all connected medical devices on segregated networks?
Carter, do you want to take that one?
Yeah, and I think, look, Nuvolo is not a scanning technology, and so this is why we've spent so much time talking about how scanning technologies who are able to look at different segmented virtual lands and aggregate that information and then get it into the Nuvolo system. That's the key. And so yes, there are segmented networks out there, and there are medical devices that end up on different networks, and that's part of a program, is looking at how you optimize your segmentation strategy, your micro segmentation strategy, and how it works with IT and the overall vulnerability management program.
Yeah, and the development work that we've done with those third-party discovery and monitoring tools, that enables us to bring in the information that they're gathering. And so, as Carter was saying, whether they're gathering from a single network or a multi-tiered segmented network, we've done that work to be able to bring that information in. We're not scanning ourselves. That's why we leverage best of breed to do that for us, and we integrate with them.
Thank you, Tony and Carter, for your time today and for a great presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the services they provide to our industry. Please visit nuvolo.com. A quick reminder that you can obtain your continuing education certificate by completing the post-webinar survey. The survey will be emailed to you 1 hour after the end of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once you submit the survey. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar. Please visit webinarwednesday.live for more details and for complimentary registration. Thank you all and have a great afternoon.
Thank you.